Thanks for joining us, everyone, and thanks for having me today. Today we're going to talk about pathways to asthma, creating your community health worker or your CHW lane. So just a quick overview about CHW Solutions. Our company was launched in 2016. We are based in St. Paul. We do service a statewide area. We are dedicated to developing sustainable models for community health worker services. And we have 3 service buckets. We provide direct CHW services, clinical oversight and claims submission, and technical assistance and consulting. All right. So today we're going to talk about the Ohio Pathways model. The Ohio Pathways model, and I'll refer to it as pathways from here on out, helps eliminate health and social disparities by finding those at risk, connecting them to care, and measuring the outcomes. It was developed in 2001 by 2 physicians in Ohio. It's a patient-centered tool to identify and translate patient risks. It addresses the social determinants of health. There are 20 pathways, and it's a wonderful way for community health workers to guide their practice. All right, so here we can see the pathways. So there's a variety of pathways that a person could choose from. All of the pathways revolve around the patient. So as the community health worker is working with the patient and different needs are being identified through assessments, through face-to-face conversations, maybe through some information that the community health worker is getting from the clinical team, the patient is always going to be at the center. And as that information comes into play, the community health worker is going to be opening up pathways for the patient. So if you look at this picture on the screen, you have this particular patient has a housing pathway, a medication management pathway, education, social services, medical home, and health insurance. So these are all areas that either A, came up in conversation, B, were identified through using assessment tools, or C, patient identified that these are things that they need help with just off the bat. There was no assessment needed. Or again, it could have come through clinical team, so something that the patient mentioned to the clinical team, that the clinical team is sending the information to the community health worker and saying, this is what this patient needs help with. Today what we're going to do is we're going to look at some of these pathways in depth, and we're going to chat about how as a community health worker you can use the pathways to stay in your lane. All right. So first of all, let's refresh ourselves on what the role of the community health worker is. So community health workers in Minnesota deliver face-to-face services with client in a community setting. This can include their home. It can be a community setting such as a park. It could be their work. It could be going grocery shopping together. It could be going for a walk together. Wherever the patient is comfortable and wants to receive the services, a community health worker has the freedom to go to that location and deliver CHW services. So also keep in mind that when I say face-to-face services, what I mean is if you are accessing the Medicaid reimbursement that's available in the state of Minnesota, all of those services need to be delivered face-to-face. A community health worker connects patients to community resources, social services, and health services, helps patient build self-management skills, understand diagnoses, treatment, medication complications, risk factors, and prevention, works collaboratively with primary care teams, social workers, care coordinators, and other case managers in a variety of settings. Again, community health worker has the freedom to deliver services in a variety of ways, and also with that person, with the patient with them, during a face-to-face visit can interact with other people who are involved in the circle of care of the particular patient. All right, so let's take a look at a scenario. Scenario number 1. We have Mary. She is a 32-year-old female. She has a clinical asthma diagnosis. She's currently facing eviction. She had a recent layoff resulting in loss of insurance. She has a history of medication noncompliance. She has no asthma action plan that she mentions. And she has no high school diploma or GED. So this may be information that you as a community health worker get from Mary right away off the telephone call and asking her some quick questions to schedule your first in-home visit. It may be information that you're getting from a clinical team or from another referral that came to you. But this, for scenario number 1, this is what we are dealing with Mary. So keeping this information in mind, here are the pathways that we have identified for Mary. So we've identified an adult education pathway because she has no high school diploma or GED, an education pathway because there is a clinical asthma diagnosis, an employment pathway because she had a recent job layoff, a health insurance pathway. Again, she had a recent job layoff resulting in the loss of her health insurance. A housing pathway because she is facing eviction. A medication assessment and a medication management pathway because she has a history of medication noncompliance. Medical referral pathway because she has no asthma action plan as she self-reported. And a social service referral because she had a recent job layoff. So if you go back up to bullet number 2, the education pathway, this is a pathway that community health workers can use for every visit. Every visit that they're going on is going to be rooted in some sort of clinical diagnosis. In Mary's case, it is asthma. It may be diabetes, it may be hypertension, it may be cancer, it may be lead poisoning, whatever the clinical diagnosis is and however this person came to you, you can use that education pathway to deliver health education messages to the patient. All right, so let's start with our adult education pathway. So all of the 20 pathways are written in a similar way. They are all available on paper. They are also available through, if people are using the Ohio pathways in the database, they can also be in that database and you can have electronic versions. You can also build the pathways into your own EHR, which is what we have done at CHW Solutions. So we have identified an adult education pathway because Mary does not have a GED. So our goal is to get her connected with GED programs in her area so that she can get her GED. So if you look at the graphic that's on the page here, we can see our client's name is Mary. We have her date of birth. The community care coordinator or the community health worker is me. The agency is CHW Solutions. The start date was 7/15/2018, so that's the day that you are starting this pathway or opening this pathway. And I do want to mention that Mary is completely fictitious. She is not a patient of CHW Solutions. She is absolutely fictitious, and her scenario is fictitious. But you can see how this scenario would play out. So in the left-hand column, you have boxes. Those are the boxes that are going to guide the CHW to be able to help Mary through this adult education pathway. So on July 15th, 2018, we opened this pathway. So the first initiation point is that the client identifies educational needs. So this is probably going to be through general conversation with Mary. She's just lost her job. She's trying to find a new job, and she identifies to you that she never finished high school and she does not have her GED. So you're going to partner with the client to establish or review educational goals. Document goal and desired outcomes. So her educational goals are to enroll in GED courses for the 2018 and 2019 school year. The next box, assist client in registering for training or educational course. Gather necessary documentation for registration, and determine if client needs to take an assessment or a placement exam and schedule the exam date. So helping Mary maybe get on the website for her school district and find out where her GED programs are offered. What is the necessary documentation that she needs to register? Writing those things down for her so that she can start finding those and access where they need to go. And then determining if the client needs to take an assessment or a placement exam to schedule the exam date. So this is probably going to be in a phone call that the community health worker can make with Mary to figure out if she needs to have an assessment, and if so, help her schedule that date. Then you're going to confirm that the client is registered in class or a training program and confirm that they attend the first class. You're going to monitor your client's progress with educational program. Confirm at least biweekly that the client is attending classes and document the progress. And then the completion or the closing of this pathway, confirm that the client successfully completes stated educational goals. Their course or their class is completed, their training program is completed, or their quarter or their semester is completed. Okay, so as you can see, this entire pathway is not going to be closed in one face-to-face visit with the client. It's going to take some time. So the first date of the class was September 4th, 2018. So while we were there together, July 15th, 2018, you can see that we called the school district to explore her options. The next visit on 7/23 assisted with enrollment documents and scheduling an interview. So the school identified that Mary needed to have an interview. On August 8th, 2018, reviewed acceptance letter with client and helped client enroll for classes for a 9/4 start date. So by August 8th, Mary had received an acceptance letter from the school that as a CHW, I reviewed that letter with her and then helped her enroll in her classes. Her start date was September 4th, 2018. So as a community health worker, I'm helping Mary work through this pathway in order to get herself enrolled in GED programs. All right. So I mentioned before the education pathway. This is one of the pathways that at CHW Solutions we use on every single visit. It's going to capture information about what was done that day. It also is going to capture information about the asthma education and the education materials that you are using during the visit. So again, we're working with Mary, have all of the information up there. On July 12th was the first visit with her, and that is the start date of this pathway. So the initiation, the education pathway started from a referral from another provider. Document the education provided. So you're going to document the content, the educational content, the module, the section, etc. So on this day, I discussed the patient's asthma history and daily management, reviewed the patient's triggers. So again, this may be information that you're getting from a clinical care team. It may be information that you're just chatting with the patient and trying to identify more information about the patient's asthma. I'm going to document the educational format used. So today, on this day, I used the CDC's common asthma triggers, and I also used the American Lung Association's list of symptoms, causes, and risk factors. So I had talking points and I had a handout. And then the client reports that he or she understands the educational information. So that would be completion of the pathway. So on this particular educational pathway, this is what community health workers can use to document their visits. Many times community health workers or in-home visiting professionals in general may not have internet access when they are in a home doing an in-home visit, so they may need to do their documentation on paper and then take it back to their office and do their inputting either into their EHR or into another system or into a spreadsheet, depending on how the organization is capturing that information. And using this education pathway and opening up an education pathway during every single face-to-face visit can really help capture that information when the actual documentation is not being done right during the visit. So other things that I would write on here, again, any videos or worksheets or talking points that I used, cleaning demonstrations, primary care team messaging, best practices. It all depends on the education that you're delivering and the way that the client or patient identifies that they learn best. I find that a mixture of videos, worksheets, talking points, conversation, using assessments, there's so many tools that can be used to identify where a patient is at in their self-management of their condition. All right, and we also remember that Mary had lost her job recently, so we're going to open an employment pathway for her. We're going to connect her to employment resources. So in this particular pathway, right off the bat, I want to make sure that she's connected to her local workforce center, the Hennepin County Employment Counseling Services, introduce her to online job search platforms if she doesn't know about them already, connect her to resume assistance. And also, if Mary doesn't have internet at home or maybe doesn't have a laptop at home, connecting her to a public library that's close to her where there's Wi-Fi and or computer access. So in the employment pathway initiation, the client is requesting assistance in obtaining a job. So as a community health worker, I'm going to partner with the client to identify her education and work history. So her previous work experience, educational level completed, employment goals, special training needed for desired job, and any barriers to employment. So if there's a felony record or financial constraints. The care coordinator will work with client to confirm the resume is completed. Care coordinator, or CHW, will work with the client to monitor applications submitted for employment. And then the completion would be that the client has found consistent sources of steady income and is employed over a period of 3 months. So you can see this employment pathway is going to be opened for at least 3 months. And in reality, probably a lot longer than that. So our start date for this particular pathway was July 15th, 2018. And Mary identified that her work history was a line cook, an office cleaner, and a supermarket checker. Her education level was some high school. Her employment goals are full-time work with health insurance. Her barriers are no high school diploma or GED. So we did those those pieces during the first visit. And then as time progressed, her resume was completed on July 31st, 2018. And as she was looking for employment, she submitted applications to Menards, Target, and Whole Foods. So you can see the dates on which she submitted those applications. And then as time progresses, when we have future visits with Mary and we're working on the asthma education, we are also going to check back in about the progression of the employment pathway and the progression of the job applications that she's submitted here, plus we would probably add more as she moves forward. All right, we're also going to open a health insurance pathway for her because when she did experience her job loss, she also lost her health insurance. So right away, we're going to connect Mary with a MNsure Navigator. And this pathway, simply the client needs health insurance. So our job as CHWs is to assist the client and or the family in completing forms as directed and submitting to the appropriate agency. Well, here in Minnesota, we do have a long list of MNsure Navigators all over the state. So what we're going to do as CHWs at CHW Solutions is connect Mary with a MNsure Navigator that is convenient for her and that's a person that she can connect with, that's close to her home, and that person will help her apply for health insurance. So on 7/27, she had an appointment with a navigator. She went to that appointment. She brought the information that she needed. While I was at the in-home visit, we confirmed with the agency that all forms had been received and had been completed properly. You know, when you apply for health insurance, there's a lot of things that you have to bring with you. And so as the CHW, we were able to call together to MNsure to find out what does she need to bring to the navigator appointment so that she was ready on that day and it didn't delay anything else. And then the completion of this pathway is to arrange follow-up within 2 to 6 weeks of application submission to confirm acceptance or denial of insurance. So on 8/31/2018, we had a visit and found out that Mary was accepted and approved for medical assistance. So she was good to go as of September 1st. She would have been insured. And so by having this pathway with me, I know that I need to, at my visit, check in with her and see how that health insurance application process is going. All right, so a housing pathway. If you remember, Mary is facing eviction. So right away as a community health worker, I'm going to connect Mary to housing resources. If emergency housing is needed, connect to the shelter system for intake. So we started this pathway on 7/15, and that the client is identified to be in need of affordable housing. She had identified that the reason for needing new housing is eviction. So we're going to partner with her to contact appropriate housing organizations and schedule an appointment to meet and discuss housing options. And we're going to help the client prepare for meeting with required documentation, child care, transportation, anything else that Mary might need. Care coordinator confirms that client kept appointment with housing organizations. If client is placed on a waiting list for housing, obtaining the names and the phone numbers and the contact people to follow up with regarding status. So housing is one of those pathways that does not get closed very quickly, just in general. The completion of the pathway is confirmation that the client has moved to an affordable, suitable housing unit for a minimum of 2 months. So it may take Mary quite a bit of time to find somewhere that she can call home. And Clients might be in the shelter system for a while. They might be living with family members or friends for a while, and that's okay. This housing pathway will stay open until that she's been in her own place or what she's looking for a minimum of 2 months. So we scheduled an appointment we called Common Bond. She had an appointment with Sally on the 7th of August. And you can see Sally's information, her phone number. And then I checked back in with Mary on those dates. And I was just checking in as I was doing a face-to-face visit with Mary, working on her asthma. The first 5 minutes of my visit, I'm always going to be checking in on open pathways. There may be change. There may not be change. It's totally fine either way. But just remembering to check back in, asking her if she needs anything else. And in the meantime, just from, networking as a community health worker, we may have uncovered another resource that we could offer to Mary. So adding more information, connecting Mary to other places, those are things that we can do while we're waiting for this process to move forward. Medical assessment pathway. So we also identified that there was a medical assessment, medication assessment pathway that was needed because Mary had a history of noncompliance with her meds. So this is something that a community health worker can do. A community health worker is typically not going to be sorting meds or touching meds or helping patients fill pill boxes. What they are going to be doing is helping to get information from the patient using these pathways to give to skilled nursing in-home visitors, clinical care teams, so that everyone has the same understanding about what's really going on with the patient's meds. So what a community health worker can do is record all medications that the patient is currently taking, including prescriptions from other providers, record what client says in her own words, and send this chart to Mary's new primary care provider. So on September 17th, we started working on the medication assessment pathway. What we're going to do is we're going to complete this chart, and we're going to take into consideration all of the meds that Mary has in her possession, what she thinks she should be taking, what she doesn't know how to take, and we're going to ask her questions about how she takes them. We want her to tell us. So in this pathway, you're going to record what the client says about his or her medications. So we started this on the 17th, and you can see a fax was sent to primary care on the 18th, and then a CHW should follow up with primary care and make sure that they received that fax. So on this medication chart, one of the things I would do is I would ask Mary we would sit down at their dining room or kitchen table, ask her to bring out all of the meds that she has in her possession, and we simply just start writing them down. So let's start with her Symbicort. So she has her Symbicort. Can she open it? Yes, she can open it. Ask her, what is this medicine used for? And she said, to reduce lung swelling. How many doses each day? She said 2 puffs 2 times a day. Can she read the label? Does she know how to get refills? These are things that she's going to tell you about every medicine that she has in her possession. Whether she's supposed to be using them or not, or she thinks she's supposed to be using them or not. We want to make sure that we're getting a really good take on what she's doing on a daily or a weekly basis. So we went through, you're going to go through all of her meds, you're going to ask her all these questions, and then you have this awesome chart that you can send to primary care. And these are Mary's words. These are your patient's words, not the community health worker reading what the actual pill bottle instructions are or the actual inhaler instructions. They are what the patient is telling the community health worker in their own words. All right. So we're also going to ask her some questions. Have you been having problems getting your medications? And Mary said, yes, I lost my job and I no longer have health insurance. Well, that is going to tell us, okay, there may be a point at which Mary might be uninsured. So we need to make sure that we are still connecting her to resources if there is a gap to be able to make sure she has access to her meds. Do you have problems paying for your medications? I have $50 a month that I can spend right now. This is my money that I have in savings. I could pay $50 a month for 3 more months. Okay, so we know Mary has $50 that she can pay right now, and she can do that $50 a month for 3 more months. Hopefully, because we're going to be speedy about connecting her to a navigator, she'll be connected with insurance, Minnesota Care, medical assistance quickly, and this will not be an issue, but at least we know, okay, this is what she can do, and her primary care provider can work with her to decide, okay, these medications are the top priorities for Mary, so let's use her $50, and then they can decide which ones she needs and which ones are a priority for her. So you can see how this would help a primary care team be able to have a conversation with a person who is in need of these services. The medication management pathway. So Mary has prescriptions for multiple providers. We're going to, as CHWs, we're going to assist Mary in contacting all providers to obtain lists of medications, complete a medication assessment chart with Mary, and we're going to fax the current medication to the current primary care provider and the new primary care provider. We're going to follow up with primary care and Mary. So this is kind of step 2 here. We've taken the assessment. We have the information down on paper. We have something to follow up with primary care, and we're going to send this information over to them. You might receive a referral from a specific care team or from a specific clinic, but the patient might have multiple providers and might have prescriptions from multiple providers. You may only know that if, as you start meeting with the patient and you're starting to work with them face-to-face. So it's important to include all providers in the medication management pathways. In the medical referral pathway, again, Mary mentioned she does not have an asthma action plan, and we're going to assist Mary in scheduling an appointment with her primary care provider. In the social services pathway, since Mary did recently experience a job loss, we want to get her connected to cash assistance as soon as we can in her county. So the social service pathway, we opened it on, let's say, July 15th. The code number, if you look at the bottom half of this page, the code number 6 is going to tell us that she was referred to financial assistance. And then the way that the appointment, it was that the patient had the paperwork from the appointment. That was on August 6th with Hennepin County so that she could get enrolled and get some cash assistance flowing to her. All right, scenario number 2. So for scenario number 2, we're going to talk about Joey. He is a 10-year-old male. He has a clinical asthma diagnosis. He experiences frequent ED visits. He has no primary care provider. He has exacerbations at school. Asks the school nurse for extra food to take home. And he is currently uninsured due to failure to send in updated household income. Okay, so the pathways that we identified for Joey: education pathway, because he has that clinical asthma diagnosis. He has frequent emergency department visits, and he has exacerbations at school. Health insurance pathway, because he is currently uninsured due to failure to send updated household income. Medical home, because he has no current primary care provider. And social services, because he asks the school nurse for extra food to take home. All right, again, we are going to open this education pathway because we are always going to be doing asthma education with Joey and his family. So we're going to work on asthma education for kids. We're going to work on his triggers. And we're also going to work on the appropriate use of the emergency department. So our visits with Joey started on September 4th, 2018. It was a referral from another provider. During this visit, we used a CDC podcast for kids called Asthma Facts. We used the Children's Hospital in Minnesota Trigger Control. And we used talking points about appropriate ED use. So these are the educational materials that we used during our first visit with Joey and his family. All right, so right away we're going to open up a health insurance pathway because we know that Joey is uninsured. And we're going to connect him and his parent or guardian to a navigator. In this particular case, there was a navigator at Joey's school, so that was a nice connection, something that can be done right at school. They don't have to go down to the county or another spot right away. They can just meet with the navigator at school. And if you remember, the reason that Joey was dropped was failure to submit updated household income. That, in my experience, is a very, very, very common reason that people are dropped from insurance. So hopefully his case will still be open and sort of hanging there and waiting for those documents to come through. If not, they may need to reapply. But the navigator will work with Joey and his family, and that person will connect with them to make sure that all of the appropriate information gets back to MNsure. So as you can see, on September 28th, 2018, we confirmed that Joey was back on medical assistance. Woohoo, go Joey. And so now we can start working on a medical home for him. So we're going to help Joey and his family choose a medical clinic for Joey. We're going to use motivational interviewing to identify what is important to the family when choosing medical care. So the payment source of his clinical visits as of September 28th is going to be Medicaid. They have chosen Dr. Sunshine at Children's of Minneapolis. The initial appointment that they had was October 11th of 2018, and they did keep that appointment on October 11th, 2018. All right. So because Joey had asked the school nurse for extra food to take home, we're going to open a social service pathway, and we're going to get Joey connected to food assistance. So on September 4th, 2018, the code number should actually be 3 because we're going to get him connected to food assistance and or WIC, depending on what they qualify for. So we're going to connect them to the county for that. And we're also probably going to bring Joey a list of food shelves, produce giveaways, and other places within their community that they can go either receive food or they could go have a hot meal, places like Loaves and Fishes. So a little bit of legwork on the CHW's part if they don't already know what resources might be available where Joey lives. But if Joey lives in Hennepin County, there's a lot of resources, or Ramsey County, Dakota County, depending on where Joey lives. We can find resources for him that are above and beyond a social service referral to the county, things that are right in their community that they can access. All right. So there are some tools that help community health workers identify clients in the community. We can use assessment tools, quizzes. We can engage the patients and or the patient's family in a variety of different conversations to identify if they may be in need of CHW services. For example, we could be having lunch at Salvation Army. We could have a table there with information. We could have a quick asthma self-assessment quiz available for people. And if people feel that they may have asthma, we could start conversations with them right away. We could use a standing order written by a medical director so that we can be boots on the ground and begin services right away once we've used this assessment tool. And it doesn't have to be just this one. This is an example. But there are a lot of assessment tools out there to be able to help community health workers commence services right away. Because if we are at Salvation Army and we meet someone and we do an assessment with them and that person identifies that they may be at risk for asthma or for diabetes or for hypertension, what may happen is they may have to go back to their primary care clinic and get a referral or an order for community health worker services. But we can avoid that. We can totally bypass that by having a standing order ready for us, written by a medical director who is going to say, yes, that person meets the criteria for this standing order. That person has self-identified that they are at risk for this condition, and a community health worker can commence services right away. It's a much, much quicker way to get the patient's services than waiting for the patient to go to a primary care clinical visit and having an order written by their care team, which can absolutely happen, and that's a fabulous way to get referrals. But if you're boots on the ground, if you're a community health worker that's really boots on the ground and providing these services in the community, this is a really quick way to commence services. It's also, we can create best practices. So we're going to give a little bit of background on the condition, educational messages, resources available to use, and references that we used in providing this best practice. And what this does is we're creating a best practice that community health workers can have all of the information at their fingertips. And we can avoid hours of Googling and trying to find things that, things that community health workers need right there, right when they're working with the families or working with the patients or working with the clients in the community. They can have their educational messages, so we're all on the same page about educational messages, what's being said, and then as managers and supervisors, you are feeling great that your community health workers are accessing information from reputable sources. We know there's lots of sources for health information on the internet, and we could Google for hours and find hordes and loads of stuff. But what's really important is that the sources are credible. And so by creating a best practice document for each condition that you are working on, this helps the community health workers stay in their lane with their messaging and also with the sources and the information that they're giving out in the community. So at CHW Solutions, we don't necessarily see our community health workers every day because they're in the community visiting patients. But by creating best practice documents and using standing orders and then connecting with them, we already know they're using the documents that we want them to be using and that they're delivering the messages that we want them to be delivering. So standing orders and best practices go hand in hand when your community health workers are boots on the ground in the community. And then, of course, documentation, which documentation is a giant piece of delivering community health worker services. we talked a little bit about how documentation can be done on paper and then later uploaded into the EHR. It can be done straight into an EHR. It can be done in a variety of different ways. The nice thing about using the pathways is that you don't have to worry about having internet access while the CHW is doing face-to-face visits. At CHW Solutions, we use the pathways and we use another form to document during our in-home visits, another form that we created. And then we have our EHR, and when the community health workers are later in the evening or right when they get back to the office, they can do that quick 10-minute documentation on that visit and then scan and upload the actual paper that they had during their visit. It's a really nice way to do it, and then it's totally fine if there's not an internet connection during the in-home visit, because you might be in a park or you might be in a grocery store or you might be in a place where internet just simply doesn't exist, and that's totally fine. All right. Well, thank you so much for joining me today. I'm happy that I was able to be here with you. Here's my contact information. Community Health or CHW Solutions has 3 partners. I am Megan Curran de Nieto. We also have Megan Ellingsons, 2 Megans, and David Rock. 3 of us are available to answer any questions that you might have. Feel free to send us an email or a text or a call, whatever is comfortable for you to get a hold of us. We would love to chat with you. We have lots of great stories and information and all sorts of things to offer you. So thanks so much, everyone. Have a nice day.